This is Dr. Kamala Tamirisa, one of the cardiac electrophysiologists with Texas Cardiac Arrhythmia in Dallas.
Kamala, would you able to discuss a little bit with us about ablation and whether they can or cannot occur during pregnancy?
Absolutely. So ablation, usually it's better to keep it as the last resort and keep it to be safely done after the delivery. So that's one statement I will say. Very important, unless the center is highly equipped with MFM, fetal monitoring, all the support system. And the indication for ablation during pregnancy needs to be incessant, where the patient has failed all the medications and hemodynamic compromise. And have I done ablation during pregnancy? I have, but they were very incessant. One was incessant VT, other was incessant accessory pathway mediated tachycardia. It was a left lateral pathway and didn't respond to anything we did. So going to cardiac ablation during pregnancy, the beautiful thing about EP is we have evolved from using radiation to not needing as much radiation for our ablation procedures. So intracardiac echo utilization and electroanatomic mapping systems is important. There's not much data that is pretty consistent about using the gonadal or the abdominal radiation pad. Not using it is important because of the scatter that gets under if the pad is not placed in the right location. And then minimizing, reducing the fluoroscopy, everything, collimation, low frame rates, using as low fluoro as possible. Fetal monitoring is important during the ablation, keeping the cases very short. And then the third thing is the lateral displacement of the uterus, especially if the pregnancy beyond 20 weeks is important. And once the fetus is at the stage of viability and beyond, which is 24 weeks or more, very important to have emergency C-section team available if we are taking to the lab in case there's a complication with the procedure, something we need to be ready and be thinking of all those. So bottom line is, yes, they can be safely done, but it's better to wait until the delivery and the indications incessant and they have failed all the other medications.